Kirkpatrick, do you feel like you're getting enough air? I'm going to give you a few breaths manually with an ambu bag.
Always respond to ventilator alarms. Sometimes you'll be able to readily identify the source of the alarm. Other times, the cause will be less obvious. If that's the case, disconnect the patient from the ventilator and use a manual resuscitation bag with 100% oxygen to ventilate the patient until someone can help you troubleshoot.
Could someone call respiratory therapy, please? He'll be here in just a minute. Feel like you're getting enough air now?